One of the most important things you can do if you have Hashimoto's thyroiditis is treat your condition as early as possible. The whole reason for this is you want to prevent what's called end-stage Hashimoto's thyroiditis. End-stage Hashimoto's thyroiditis refers to the complete destruction of your thyroid gland. Here are 3 signs you might already be in this state. Number 1 is thyroid gland atrophy. Thyroid gland atrophy refers to the shrinkage of your thyroid gland. When the thyroid gland gets permanently damaged, it actually shrinks in size, and you can identify the size of your thyroid gland by looking at it via ultrasound. This should be differentiated from thyroid gland inflammation, which usually increases the size of the thyroid gland. So early stage Hashimoto's thyroiditis, you have an increased size of the thyroid gland, and late stage Hashimoto's thyroiditis, you have a shrunken or atrophied thyroid gland. Number 2, you may see your thyroid antibody levels drop or reduce or lower. You might be thinking to yourself, well, this is great, my thyroid antibodies are lower, but that isn't the case in end-stage Hashimoto's. This would be a good thing if you were actively trying to use therapies and treatments to reduce your antibody levels, but in the case of end-stage Hashimoto's, this occurs without any of those treatments. The reason it occurs is because as your body completely destroys the thyroid gland, your immune system no longer has a target for which to create the antibodies to. So in this case, the reduction of your antibodies is not a good thing. And finally, number 3, you may experience extreme problems in gaining weight and a difficulty in losing weight. This is because the thyroid gland is the main regulator of your metabolism. When you have complete destruction of the thyroid gland, you no longer have the ability to regulate your metabolism as easily as you once did. This means you are now reliant upon thyroid medication that you're taking by mouth to control and regulate your thyroid, which controls and regulates your metabolism. And because thyroid medication is never as good as the real thing, in this case, your thyroid gland, these patients who are in end-stage Hashimoto's almost always have some degree of weight loss resistance or difficulty in losing weight. All hope is not lost, even if you do have end-stage Hashimoto's. Yes, it will be more difficult to get treatment, and yes, you will have to focus and rely more on thyroid medication, but natural treatments and therapies still are effective. No matter what stage of Hashimoto's you're in, you should always be trying to do something to improve your condition.